Why? Why would you get, what would you get from running down your own country's pharma industry?
Padmaja, I don't understand one thing, that just seeking a question from the ruling government or the party, how come it becomes a running down the government or running down the nation?
Nobody is running down the government. You can run down the government all you want. That is what the opposition does. It is when you run down the pharma industry. What is this? What is it that was said today morning by the Congress? It was said that Prime Minister should stop gloating about India being the pharmacy of the world, and he should see what is happening, because Indian cough syrup is responsible for the death of Uzbek children. Well, news flash, Indian cough syrup is not responsible for the death of Uzbek children. Even Uzbekistan is not saying so, but we are saying so and saying stop feeling proud of your industry. Why?
That's your statement.
No, it's
just
not
now
my statement.
I have heard just now the MEA spokesperson, what he said, that the representatives, the legal action is being taken there in the Uzbekistan.
Okay.
He said Uzbek authorities have not taken up with the government of India till now.
No.
The embassy did some investigation at
No,
their
sir.
own end.
I
You
will
are
tell you
denying
what
the
Uzbekistan
statement
has
of
said.
your own MEA.
Arey sir,
Your own
hold on
MEA.
a second. You are misquoting the MEA. You are misquoting Uzbekistan, just like you misquoted Gambia. First of all, for the uninitiated, because mostly these stories are relegated to page 108. The same papers who would have put the WHO statement on the Gambia cough syrup on page 1 would then print a retraction on page 108. So let me actually quote to you what happened with the entire Gambia story. In Gambia story, World Health Organization prematurely linked the deaths of children to the cough syrup made in India. Fair enough, action was taken against the company. Eventually what happened? On the 2nd of November 2022, Gambia itself said that the connection of toxic cough syrup to the death of 70 children has not been confirmed. That is what Gambia said. The claim that toxic cough syrup allegedly caused the death of 70 children in the small country of Gambia in West Africa has not been confirmed by Gambian authorities. Subsequently, you had the Drug Controller General of India writing to the WHO saying a premature link was drawn between the deaths of children in Gambia and the 4 Indian-made cough syrups, which adversely impacted the image of the country's pharmaceutical products across the globe. This letter was written by Dr. V.G. Somani to Dr. Rogerio Gaspar, who is the Director of Regulation and Pre-Qualification. So there was fear mongering and tarnishing that happened. In the latest case also, what has the country said, Uzbekistan? They have said, hello, this particular cough syrup was certified in their country. Point number 1. Point number 2. Let's put out in fact what the Uzbekistan authorities have said. Uzbekistan authorities have said, point number 2, that this was taken without doctor's prescription, Ravi Srivastav. 3, that it was taken in large doses. And 4, it was taken in conditions which are unsuitable. When you take it at body temperature, it can cause irreparable harm. But we are like, no, India is terrible. Indian drugs are terrible.
Why are you advocating so much? Is it not the bad press for country? Is it not the world is seeing that some kind of a bad product is being manufactured in India? You are trying to justify.
Did you not hear what I said?
Who said that?
Nobody is calling the product bad except you and the Congress.
Why a criticism cannot be taken in the right earnest?
Because the criticism is misplaced, my friend.
If the criticism, government should take it in the right spirit and see to it the controls are done properly.
Sir,
why is the saline
I will give you, and since we are making, since we are in the realm of the ridiculous now, let me give you an analogy. This is like me saying, you Ravi Srivastav are a COVID super spreader. And when you say, but I don't even have COVID, I say, but this is criticism, take it in the right spirit. Take it in the right spirit, you are a COVID super spreader, go.
Your analogy is baseless.
No,
a COVID
your
patient
criticism
and
is
a cough
baseless.
syrup are two different things. They are being administered to the small children and their lives are lost. So somebody has to be held accountable. Somebody has to be held accountable for this. Whether it is DGSI, whether the manufacturer, whether the company exporting it, whosoever it is. And there was a test report, I said, there was a content of ethylene glycol in that, in a higher content. So there is a problem with the product is substandard. Somebody is making it without taking proper licenses. The company should be stopped immediately and they should be booked for a crime.
Okay.
That
Please
action is
respond to this
required.